Hi, I'm Dr. Jen Remnes.
And I'm Dr. Jess Trice, and this is Real Talk with Vet Candy.
This program is brought to you by KBroVet. Learn more at KBroVet.com.
So guys, we have some news. I'm going to spill the tea a little bit over here, or the champagne. We have a brand new mama over here.
Yay! And it's so interesting because the last time when we did Real Talk, I had my daughter 1 week later after we did our first episodes of Real Talk. So
I want to think because your legs were swelling by the hour. She was literally like,
I took off the shoes. They were done. I was flat foot.
I knew she was coming.
Yeah.
I knew it.
You thought it was like next day, right? Yeah.
It was like, yeah.
But 1 week later, she came. So we felt this would be an appropriate topic to talk about motherhood and talk about the whole life balances of being a mom, being a wife, being an entrepreneur.
A new entrepreneur.
Being everything.
Yeah.
And how do you balance all these things? Because it's a lot. So yeah, let's dig deep into this. But I guess going back into being a mom, I wasn't planning right now to be a mom because obviously there's a lot of things that come to being an entrepreneur, starting up a business. I mean,
you have a lot on your to-do list.
That's a baby in itself. Like starting up a business, Vettique is our baby. Like we're parents of Vettique. So that has so much going on the last 2 years. I mean, we've just been doing so much. And so we've been nurturing it. We've been trying to put it together.
How does she do it all?
Yeah.
How does she do it all?
And in Spanish, we say igualmente, means the same thing. So, but you know, it's just, it's a life balance here. And before I thought about digging deep into all of this, you know, I wanted to be a mom. But, you know, as being single, how was I going to do about this? And I think it's really important for all of us because, you know, we're veterinarians and we're constantly putting our work first. But I want to make sure that everyone knows that as a woman, if you plan on having children or not, if you want to be a mom or not, you really have to make sure that you plan ahead of time. As far as when you're in your 30s, it's so important to, whether you want to be a mom or not, to start freezing your eggs or doing something where you can potentially have something involved with babies, you know, having kids in the future. And apparently when you're in your 30s, that's where a lot of times people don't know this, but the number of eggs that you have drops at least by half. Your fertility drops by half. Your
what
eggs.
Age is that?
30.
Uh-oh. I'm above there. I know. I mean, this is an entirely new topic that is brand new to me.
Yeah.
I am 34. I'll be 35 this summer. I have my mom creeping in my left ear over here. Where are my grandkids? Where are my grandkids?
Yeah.
New business on the right side, trying to juggle all of it. And it is hell. It is hell.
It's a lot. It's a pressure.
I have a lot going on.
Yeah.
I mean, I wish somebody talked to me about freezing my eggs 5 years ago. That would have been great.
Me too. I'm in the same boat with you. Even though I'm not in my 30s, I'm in my 40s. I have no shame. I'm in my 40s. But I will have to say, in your 30s, you know, you actually drop 50% of your fertility of your eggs. And by 35, I mean, it drops tremendously even more. So every person is different, obviously. You want to make sure you talk to your doctor. But if you're planning on having children, I mean, really think about
biological clock is ticking over here for
yes.
me. I know.
I love the movie Marissa Tomei. And my cousin Benny, she says, a biological clock is ticking like this. It is so true. I totally related to her when she said that.
Oh my goodness.
But, you know, again, as in my 40s, I said, okay, I'm a woman, divorced, single, no kids, but I knew in my heart I wanted to be a mom. So what are the steps to take? And there's different ways of going about that. But at the same time, as veterinarians, you're busy. You're on a go. You're doing so much stuff. And a lot of times we don't have time for these things.
Career first. I mean, that's our mentality.
Yeah.
When we graduate, when we have our first job,
Yeah.
on to the next, career first.
Yeah.
I've been so career focused my entire career.
Yeah. Yeah, I think that's all of us, especially as women. We put our career ahead of what we want sometimes. And sometimes you have to hit that pause button and say, what do we truly want? Obviously, we're in our dream job, which is amazing. But at the same time, you kind of have to put things in priority.
What's next, right?
What is next for you? What is in your next plan? For me, what I did was egg freezing. I froze my eggs because you just never know. And it's been a blessing. And again, there's a lot of ways to go about that. There's egg freezing. There's sperm donations. There's
And wait,
so many things.
Childfree is okay. I mean, let's be real. If we were to ask Jen 2 years prior to today if I wanted kids, I probably would have said no. I was on a boat in Spain. I didn't want a kid. I didn't want the responsibility.
And I was in Croatia 2 years ago, so I was single too.
I thought kids were not in my future, but everything changes. And I was just telling the story. I mean, everything really grounds you. I lost my dad in 2021, so not too long ago, and I saw my mom. She was wailing in a room, you know, when we were getting the news, the updates about what his status was, and me and my brother were there. And can you imagine if she had nobody else beside her?
Yeah.
I looked at her. She had nobody. Me and my brother, like, that's all she had to look forward to. So that is so important, you know. Oh, gosh, I'm sorry.
Yeah.
To talk about it.
Yeah, it's you know, having that support system and having your loved ones around. And so, and you and your brother have been so endearing to your mother, and your mother's very blessed and so lucky to have her kids, because you know there's families out there that are split families or aren't supportive of one another. But oh my gosh, you, from what I've seen that you've gone through and how supportive you are with your mother and just with everything going on, I mean, you are the ideal daughter. And you know, when it comes time, you know, when you become a mom, I know that child's going to be beyond spoiled. A little mini me here.
Your mini me that currently exists. Can we talk about her?
Oh my gosh, Miss
Elizabetha?
Elizabetha. Yeah,
Oh
so
my
Elizabetha.
A little Italian stallion.
A little Italian, a little bit of some Latin in her. So yeah, she's just definitely the joy of my life. It's, you know, we all have a purpose here in life.
Priority shift. I think that's what we have to like talk about, right? Priority shift.
Everything changes. And
so quickly.
It really does. And I had this priority of just me. Like you have this whole mentality of, okay, I got to do this and focus on this and this. Me. Which there's nothing wrong with that. But then when you have a child in your life, that changes everything. And now I feel like I have this legacy.
Or a dog kid, right? Can I bring up my little baby?
Yes. Oh.
Dog moms, you are all included. I mean, that is a kid with 4 legs.
Oh, tell them what kind of pet you have. What did you adopt?
I got a Great Dane puppy.
Woo!
Yeah, work's cut out for me. So, yeah, a kid with 4 legs. I mean, you have a focus that is not you, that you're prioritizing. And I think that's what the main focus is here.
Yeah, it really is. And again, going back to, I was taught, like, there's 2 types of deaths. There's one where you're actually, you know, in the grave. That's it. You're done. And the other one is where nobody else talks about you. Like, the life that you live, like, it stops. It ends in the grave. And for me, I want to be able to have that legacy carry on through my daughter. And so it's this whole total perspective that has changed for me for the good. And it's been a challenge, especially with being an entrepreneur, you know, working, you know, having concern about the finances that we talked earlier about in our segment. You know, how do you have this balance work and this balance home, this balance of everything? And this is just, really goes back to us treating yourself. You know, we want to make sure that you take care of yourself Because if you don't, how are you going to take care of others? Dr. Jen has been so great in recognizing that, because I think it was like my Mother's Day gift. You got me a trip to a gift certificate to the spa, and I didn't even think anything of it. And I was like, you know what? That is like the best gift ever. It was amazing.
I hope so.
Like, I don't think about these things, but you really do have to take time for yourself. And I think I was telling you how I was feeling so guilty where I didn't have my daughter for a few days because grandma would take care of her and I wouldn't have her for a couple days. I'm like, oh my gosh, I'm a bad mom, because I actually not enjoyed, but I appreciated those days of being alone and just needed my me time.
You need that.
Yeah, and you guys need to realize this, moms, especially you moms out there. It's okay to take time for yourself. It's okay if, you give your child to your, the grandparents or whoever to watch her, because you really do need that time to just kind of reset yourself. Yeah. And if you can't reset yourself, then there's no way of being able to balance things. So thank you for that time in the spa. I will be doing that, continuing with once a month here. But it's just so important, and yeah. So. Oh my goodness. So many things have changed, especially having my daughter, and Vettique has been amazing. Where as far as adjusting my schedule, and I know we had initially opened up at 9 a.m. and now we open up at 10 just to help accommodate the mornings. I am a pumping mom, so there's just so many little things that you just don't think about. And just having that supportive care, like my parents, and just kind of figuring out the schedule. But things are going to be changing, and like I said, with that whole mindset, in the mornings, I do have to make sure, like I said, I like to take care of myself. And so because of that supportive care, I've been having my workouts. Like, as anyone that knows me, I love my workouts.
Yeah, you do. This girl would work out probably 7 days a week if it were up to her.
During my pregnancy, I think it was like 4 to 5 days a week, but it went back up. But yeah, I need that time in the morning. So Vettique and the whole staff, Dr. Remnes, you guys have been amazing for that support. And I have to say, like, whatever place that you're at, your occupation, where you're at, your job, there needs to be that support for you. I'm able to pump when I need to, nursing for myself, for my child. There are places out there that don't really support that.
Yeah.
And that saddens me. Like, as a woman.
Do you mean as like having a room, or
yes.
do you? And you are very fortunate. I feel like, because you live a block away. But what does that look like for somebody else?
Yeah, I mean,
when you do relief, for instance, what do you have to do?
Well, thankfully, at the place I work at the relief, they block a time for me to be able to pump,
nice.
Which is so thankful, because in a way that's taking 30 minutes of their time for revenue, right, of an appointment. So for them to be able to block that time for me, I'm so grateful for that. Yeah. But there are places out there that don't do that.
That won't offer that.
No. And so it's so important as a woman, as a mother, that no matter where you're at, no matter where you work, they should be offering that, because it's hard. And I know for me, I'm hurting. After a few hours, I'm like, I have to pump. Let's just be real here, okay? This is real talk, right? I'm like, I gotta go, I got a jet. Give me 15 minutes and I'll be right back. But you've seen me.
Gosh, I just keep thinking of the movie Meet the Fockers. Like, Greg, I have nipples. Can you milk me?
That's true. It's appropriately inappropriate because that's how we feel, right? You moms know what we're talking about. Okay, please comment on if you're feeling this, right? Do you feel the same way? Because this is so true. But you do need to give yourself that time. You need to give yourself time to be able to do whatever it is, especially if you're nursing.
Yeah.
But you also need to give that time for yourself too, with that balance, whether it's you're adjusting your schedule. I know right now I've been looking at schools. She's only 2 months, but at the same time, it's like you have to plan for the future. What does that look like? Does your work support you in that? So thankfully, I'm at a position and amazing colleagues to be able to support that for me. So.
And thankfully, Vitique is super supportive of me having a 4-legged baby. His name is Wally. He's a Great Dane, and he ate our wall. So I'm just like super supportive.
Literally
They're okay
ate our
with that.
wall.
Like we have to redo all of that. New drywall, new paint. We'll figure it out. But yeah, I love you guys.
Oh, yeah, Vitique's amazing. But let's also talk about real talk here. Let's talk about the struggles. Let's talk about, how it can be difficult to conceive. There's a lot of women out there that cannot. When I did my egg freezing, I wasn't planning on having a child right now, but, God had a different plan for me. And so I have Miss Elizabetha, who I'm very, very, very thankful for. I couldn't imagine my life without her, and I couldn't imagine my life now. I couldn't imagine my life without her. So she's been amazing. But in that journey with the egg freezing, like I said, there's a lot of different things and ways that people and moms and couples and husbands and wives could have kids. So yeah, please, even if you don't think about not having kids, still consider.
Think about the future. Yeah. I mean, I am probably living example of that. 2 years ago, I never saw myself with a human baby. I had fur babies and they were fine, I just kept adding to the clan. But anyway, I'm 34, going on 35. Things shifted a bit. I lost my father a little bit, down the line a couple years ago here, and my mindset changed. So here I am, I don't want to say actively trying. That's so weird. That's gross. Now I'm just open to the concept. Maybe a baby will be my future. We'll see. A mini me. We'll see.
Can you imagine if you had a boy? Elizabetha and your son can totally date. Oh my gosh, you never know.
Full date.
Little future Vitica, little Dr. Trice and Dr. Remnes.
Hyphenated.
Hyphenated. That'd be so cool.
I mean, it's definitely in my future, maybe. I didn't think it was about 2 years ago. I started to consider my age, and now I'm starting to track my cycle, which is something I never did before. Like, that's crazy. I never even studied human anatomy prior to this year, which is nuts. So I definitely recommend just follow your body, follow your lifestyle, and just kind of go with it.
Yeah. And listen, again, not everyone is meant or want to have kids, and that's okay.
Yeah.
Again, it's a lifestyle. It's a decision to make,
which can change at any time.
It can totally change. Season changes, and I felt the same way too. I didn't want to have kids back in the day, and now being in my 40s, everything changed, everything shifted, and so I know that you're going to be a wonderful mother, and I am rooting for you, and I'm praying for you as well.
We'll see. I hope. I mean, I'm starting to track everything. I'm trying to do my homework. I'm trying to catch up on a couple years lost, I feel like, at this point. But, I mean, let's be real. The thought of a fertility journey at the age of 35, that's a little daunting.
It's scary, right?
It is. It's super scary. I just don't want to start this process and then realizing I'm having problems. I have to backtrack and do all this research.
Yeah.
Years lost. So my advice to you is just start early. Just start learning about your body, learning about what you think that path may be for you down the road.
I will add to that too. In my journey, there's so many ways to kind of help with that as far as fertility and things like that. So I know I did some acupuncture. Here I do acupuncture. I wasn't even doing acupuncture for myself. And when I found out that can actually be very beneficial.
She's going to start doing it on me.
Yes. But there's so many benefits for acupuncture for fertility, which has been amazing. There's also massaging therapy.
She's teaching me everything right now, which is great.
It's all that stuff, including supplements that you take, the foods that you intake. It's just putting all that together to really help.
You just have to be super mindful about what you're putting inside of you.
Yeah.
and what you want to put inside your child one day, I guess.
And
right?
don't give up, because sometimes in the first round or so, it may not be successful. But you never know, because that can also be a loading dose for you for the future of building what's to come. So I know for me, speaking personally, when I did my egg freezing, the first round, kudos and shout out to Pulling Down the Moon. They have been amazing. You guys are a godsend. They really discussed my treatment plan and how to go about things, and they're very supportive. It's a female-owned organization that really helps supports with the egg freezing, fertility, and things like that. And so when they pretty much mapped out everything for me, I followed everything to a T, and I did my acupuncture, I did the massaging, I did all that stuff, the injections.
And thank Elizabetta. She's here.
That's right. Naturally. But like I said, with that, the first round when I did my egg freezing, it was unsuccessful. It was actually a failure. And I thought, oh my gosh, this is never going to happen. I'm never going to have my eggs. Second time around is when I introduced the acupuncture. And that was a game changer. And
that is why you're pushing it on me. I got you, girl.
Yeah. So it's great, and I highly recommend that, or whatever it is. So just make sure you talk to your doctor, your whoever it is, your fertility specialist. They'll know the best plan for you. But don't give up. Don't give up. If that's truly how you feel, the path that you want to take, do it. And there's all these. We have work, there's all these stressors, right? We have financial stressors. Yeah. We have work stressors. We have a lot of things that can stress us out, but don't let that interfere or your decision of becoming a mom or having a family and things like that. And it is doable. I may not be married, but at the same time, I feel like I have so much support from my parents, from my colleagues, her father even, everyone's just been wonderful. Just make sure you have that game plan set in stone. And also too, prayer. I really feel, God has helped me through this journey as well.
Yes.
And so only through him was any of this was to happen basically. So motherhood and entrepreneur, and
she does it all.
And you too, girlfriend. So it's okay. The struggle is real. It happens. Yeah, but you guys, just talk to your doctors and talk to whoever that can help support you. And if that's the journey you want to take, by all means, take it.
You got it, girl.
And now, let's hear from an expert.
Hello, I'm Dr. Gaemia Tracy, a board-certified veterinary neurologist, and today I want to tell you 3 key insights about KBroVet CA1. In the dynamic field of veterinary medicine, staying informed about innovative treatments is paramount. KBroVet CA1 is a promising solution for managing seizures in dogs with idiopathic epilepsy. Here are 3 essential aspects every veterinarian should know about this conditionally approved medication. KBroVet CA1's efficacy lies in its scientific foundation. Potassium bromide, the primary component, traverses nerve channels, creating a negative charge. This negative charge plays a pivotal role in reducing the likelihood of a seizure signal being transmitted to the next nerve. Understanding this mechanism is crucial for veterinarians, providing insights into how KBroVet CA1 delivers targeted and comprehensive seizure control. Bromide shows excellent gastrointestinal absorption, with peak levels around 1.5 hours post-administration. It undergoes no hepatic metabolism, making it suitable for dogs with liver disease. Administered once daily in a palatable, chewable French vanilla flavor tablet, KBroVet simplifies the treatment regimen. Another way KBroVet CA1 enhances compliance is that if a dose is missed, drug concentration fluctuation is unlikely to occur because of the 21-day half-life, which minimizes the risk of a seizure and also gives the pet owner peace of mind. Veterinarians should refer to the prescribing information for a comprehensive understanding of adverse events, warnings, and precautions. Veterinarians can seamlessly integrate KBroVet CA1 into their practices, providing optimal care for dogs with idiopathic epilepsy. So that does it for today's insights on KBroVet CA1.
One thing I do want to bring to attention is, again, this is real talk. being a new mom, it's been very satisfying. It's been one of the most rewarding things I could ever imagine. But I will say, being a new mom to a newborn, it can be very mentally challenging and emotionally challenging. And I wanted to emphasize from my personal experience that what I've gone through. So the delivery was very easy. It was literally, I call her my little football. After 4, she came right out. So thank God, thank you, Jesus. So it was very easy, no pain. So it was great. I had her and everything was wonderful. And I remember I received a phone call from you saying,
You did?
Yeah, you want to share that?
This girl, literally, can I tell the story?
Yeah,
Is that okay?
by all means.
Has a baby on a Monday.
Yeah.
I have a call for an emergency foreign body that following Friday. This foreign body probably was sitting for about 4 to 5 days, so I was a little concerned about a resection and anastomosis. I was like, I don't know. I think I might need another set of hands there. So I call her up. What does she do? She comes to the surgery on Friday. What? Scrubs in. She's ready to go. Here we are.
Yeah. And I was so thankful actually when she called. And this is to the point where I was getting at, like, it was amazing to be a new mom and seeing all this happening, all these changes. But I needed a break. I needed a break.
A breath of fresh air?
A breath of fresh air, a change of scenery. And honestly, I think because of the passion that I have for pets, it just felt right.
It was innate. You had to say
it
that.
Did.
You had to say
Yeah.
Cody. It was Cody.
It was.
We'll just bring up
Yes.
Cody. He ate a Kong. It was split in two. There was part in the stomach,
Yeah.
but a little bit further down the road.
Yeah, in the
and
GI tract.
we got it out.
And we, double teamed it here, and we took that the foreign bodies, I should say.
Yeah.
But to me, at that moment, I felt a sense of relief. Like I needed that break. And I don't know about you new moms out there, or any, whether new or old, but it's just sometimes I felt a little guilty because I left my daughter. Actually, I cried when I left, and knowing that I was leaving her, she's only 4 days old. I cried leaving her because, oh my gosh, I'm leaving you. And I felt that emotion, that mom emotion just kicked in. But at the same time, I knew I needed that time to escape. And it was healthy for me. I needed that. And I want to let you guys know that it's okay to feel that way. It's okay to, if you have that little guilt, but it's okay to take time for yourself. When I experienced that, I realized I need to continue that for me. Now, of course, every mother's different, whether you need a time here and there. For me, I needed some time as a new entrepreneur, opening up a business. There's a lot going on, a lot to juggle. And for me, if I don't have my workouts or, just taking that time off, whether it's a day or two, just for me.
You have to be the best version of yourself. Let's be
Absolutely.
real.
Absolutely. Because if you're not the best version of yourself,
How are you going to be the best for your
you
daughter?
can't for my daughter.
For anybody.
Exactly. And it's okay to feel that way. It's okay to feel guilty. It's okay to feel the way, however feelings you have. It's okay to do that. So I just want to let you guys know, postpartum depression is real. Thankfully, I have a support staff and a support team and support people that love me, that have helped me through this. I have not had postpartum depression because I have that supportive care. But it is real, and if you do recognize that, you do want to make sure that you seek help for that, because again, it starts with you, and it trickles down to everyone else around you, especially your child. So take care of yourself, take care of each other, and recognize what you need. You are first.
Thanks so much for watching this episode of Real Talk. If you like this, please leave a comment or share with a friend.
And let us know what you want to talk about.
Until next time,
bye.